Hi guys, how are you guys doing? So as you can see, I'm dressing in regular clothes and I'm obviously not at home. And it's Sunday. The only reason why I'm here and I'm in street clothes is because I do have a skills day prepared for my nurses tomorrow. It is 3 hours long and I was like, I need to wake up early just to come and set up, make sure I have everything that I need. Then I was like, I may probably wake up late, so I just decided to just come on a Sunday just to take some of that anxiety off of waking up late and not having everything that I need. So it's not like I'm running to Central Supply last minute trying to get the items that I need to show the nurses. So anyways, some of the things that we're gonna go over tomorrow, I have a pretty big agenda and it's 3 hours long. We're gonna go over everything from respiratory to taking care of central lines and also fecal management. So one of the things that I am going to cover with you guys today on this video is the use of the Flexiseal signal device. And that is what we use to help with fecal management in our facility. And I know many different places uses it as well. So that's the Flexiseal. That's the box that it comes in. So I'm going to go ahead and open it. It's already open, but I wanted to show you guys everything that comes inside of it. Of course, with everything, it always comes with the manufacturer guidelines. So if you have, of course, any doubt on how to use any supplies or what anything is used for, always refer back to your little mini booklet that it comes with. So inside of the box, it has 3 different drainage bags, which is awesome because, we can always interchange it when it gets full or as needed. But if you are needed of getting more of the drainage bags, you can always get them from your Central Supply or wherever you keep your items in your unit. And you can, find more of these that just come with the drainage bags instead of the whole kit. Because, it can get expensive if you're opening up a whole kit just to get drainage bags. But they do come by itself. This is the actual Flexiseal device. So it's a pretty long tube. And it comes with this piece here where you can anchor it in the bed or wherever that you want to, put it in place. But just make sure that it is to gravity. And it also comes with a clamp. So the clamp is used just so we could, if you need to maybe like get us a sample or anything like that, you're able to go ahead and clamp the actual catheter, okay? And it also comes with a label where you can put the date and time that you insert the Flexiseal. And it also comes with a syringe. So the one thing that I will note about this syringe is if you look at it closely, it only has 45 cc's in there, and it tells you it's marked at 45 cc, which is very important, but I'm going to get to that later. And as you can see, it is a little bit different from the regular Toomey syringe that we use to irrigate maybe like an NG tube or to, to check placement on the NG tube. And it's very important that we can know the difference between those two, because say a patient has a Flexiseal and they also have an NG tube, right? So it's always good because you don't want to use the same syringe for fecal management that you're going to use with, patient that's receiving feeding. That's a big no-no. Cross-contamination, we don't want that. So that was really smart that they did this so it doesn't really fit to the actual Flexiseal device. So this is the syringe. You can use it on the port for the irrigation area. And you can also insert it in the area here that says 45 mLs. That is where you are inserting, fluids just to keep the catheter anchored and in place. So this is the supplies that we'll need. I have sterile water here, but of course, the gut is not sterile. So you really do not need to use sterile water, but that's what I have right now. So that's what we're going to be using. Go ahead and do that. Always make sure, my biggest tip is if you do have a patient with a Flexiseal, that you are labeling everything. So say that you do have your irrigation kit, just make sure that you do put a label on this that is for the Flexiseal. That way, we're not interchanging different containers for different things, because we want to avoid cross-contamination, okay? So who will need a Flexiseal? A lot of patients that gets Flexiseal, maybe they do have C. diff, and they do have a lot of diarrhea. So we'll go ahead and get an order to put in a Flexiseal just so we could, have a better management of the fecal matter that they have. And also just to keep their skin dry, because we want to avoid them from getting skin breakdown, because laying in any, you know, stool or any type of wet surface for a long period of time is really not good for the skin. It also helps us to prevent, you know, contamination, because say a patient does have C. difficile, for example, and, you know, they have like poop everywhere, so they're more at risk for us getting in contact with their bodily fluids and really having cross contamination everywhere else. So having everything goes into one drainage bag really helps to decrease the risk of cross contamination. And also, like I said, infection. Say a patient has a wound and, you know, they also have a lot of stool and stuff coming out, then that really puts them at risk for like contaminating that wound. And we want it dry, we want it clean, and we want it healing. Okay, so those are the different reasons why someone will have a Flexiseal. Make sure that if we are putting in a Flexiseal though, that the patient's stool is liquid, or at least semi-liquid. But it can be semi-formed or, you know, formed stool, because it's not going to go through the tubing, and plus the patient is going to get impacted, and it's not a good thing. Okay, so yeah, those are the items that it comes with. As you can see with the actual tubing, I don't know if you guys could see it, but it actually has a little area where I'm able to insert my finger, and the color is blue, so you won't miss it, which is really cool because it helps us with easy insertion when gliding the actual Flexiseal inside of the, you know, outside of the rectum. Just make sure that we are using gloves. And one of the things that we have to use when putting in the Flexiseal is we have to make sure that we lube the area, so it can also have easier access as well. So just make sure you put in a little lube to be more comfortable for the patient, so it can easily glide in there. Okay, so we're gonna do, first and foremost, of course, wash our hands, put on gloves, have all the supplies that were needed. Sometimes you may be able to do it on your own if the patient can turn, or maybe you'll need, you know, an extra person helping you. So get the necessary help that you need if you need it. And then make sure that we're always explaining the procedure to the patient. Let them know what you're doing, why you're doing it, and maybe they're going to feel a little bit of discomfort when you're doing it. So just prepare them, because you are putting something inside, you know, the rectum. So first thing you're gonna do is, once you turn the patient to the side, you're gonna lube the area. Just make sure the rectum is nice, it's clean, and you're gonna go ahead and put your finger inside that inside the area with the hole. That way you could have a better control of the tube for access. And then you're gonna go ahead and glide that in. The one thing that I was gonna say that is important to mention is, if you guys can see, there is a black marking on the actual Flexiseal. So what that means is you really should not be going over that marking, because if you are going any further than that, then you're probably going to put too much of the tube in, and it's not going to be good for the patient. So just make sure that you're not going too far in, because we don't want to do more harm than we're doing with good. Okay, making sure though, before you insert a Flexiseal, the patient does not have any recent surgery in their area, that they do not have any hemorrhoids, or they're not having, you know, they're not actively, they could be bleeding, but they shouldn't be having any pain or any, you know, what can I say this, like any area, like any cuts, any bruises or anything in that area. But of course, sometimes we do put these in with patients with GI bleed, because they're all putting in a lot, especially if they're putting in a lot of stool. But you shouldn't be, if you're putting this in and the patient all of a sudden starting to have, you know, blood in their stools, they're having pain, they're having irritation, then we wouldn't be putting a Flexiseal inside of a patient like that. Okay, so just make sure that you are being careful and you have the right candidate for a Flexiseal. So once you put it in, just make sure, like I said, you do not go over the black mark here, because then you'll be going too far. And once you have it in place, what you're gonna do is you're going to take your syringe, 45 cc's, let's see, some patients may take a little bit less, but you really should not be going over the 45 mLs, because we do not want to, you know, rupture anything in the rectum area. So what you're gonna do is 45, and even marks at 45, because you really should not be going over that. So if you forget how much fluids that you need to be putting to inflate the, you know, the balloon area, just go back and look at your syringe. It's exactly 45. You're gonna go ahead and push that in place. And of course, that is while it's inside of the rectum, and this is what it looks like inside of the patient, okay? So you really do not want to go any higher than that, because then it's going to be, you can rupture the balloon and you can hurt the patient as well, okay? One thing to note about the Flexiseal device is it's actually do not use latex. It's latex free, which is actually a very cool fact. So if your patient does have latex allergy, they're able to use the Flexiseal on them. All right, so this is what you use to inflate the balloon. I'm gonna inflate it right back in and take that out. So now say you have this in and you feel like, you know, you have a lot of stool, maybe like on the top, and you want to irrigate your tubes a little bit just to get some of that, you know, feces out into the drainage bag. So where you can irrigate is you can go ahead and take some fluids. You will not be doing that here because that is the port where you are inserting the fluid to inflate the balloon. So just make sure that you are using the blue irrigation port to irrigate. And as you can see, the fluid is actually going inside the actual line, and it's going inside of the patient, so it could actually irrigate and maybe, like, you know, help to soften up the stool and bring it back down as well, which is pretty cool. All right. So say a patient, you have this Flexiseal on, and you notice that, you know, it's been a little while and the patient is not putting on any stool. I always say just reassess the patient just to make sure that, you know, maybe they're not going back to normal bowel patterns, and it's not getting obstructed, because you do not want them to have any obstruction, and that's what will happen if they have all this, you know, feces that are packed up and they're not able to go through the tube, because it's not that big. So a really big form stool is not really going to be able to go through that tubing, okay? So yeah. So that's what it's going to be. And also, just one thing that I wanted to note with the Flexiseal as well, there's actually a port here that you can open here. So this is where, if you need any samples, this is where you will be able to get the stool sample. One thing that I will note also about the Flexiseal device is that we can also give medications through it. So let's say a patient needs any type of stool softeners or whatever that you need to, like, go ahead and put it through the rectal area, then you're able to, if it's liquid, you're able to kind of go ahead and push it through the tubing, okay? Like in any enemas or anything like that, you're able to give that medication through the tubing, so you don't have to take it off. So the way that you're going to put the drainage bag in place, I forgot to mention, is you're just going to go ahead and clip it. And then it stays in place. With the bag, it's really cool because it's in millimeters, so you're able to go ahead and see how much the patient is putting out, okay? Technically, these should not be on anybody for more than like 29 days. So if you have a patient that needs this more, then they really shouldn't. So just consult with the physician to see if there's any alternatives that they need to do. But these really should not be on the patient for more than 29 days, okay? And of course, do not forget to label. And if you need to get any samples or anything like that, you can go ahead and clamp it. Or if the patient has a lot of diarrhea, then you're able to, maybe you can like give them a little break, you can clamp it just to avoid them from having any spasm of the stomach area when there's so much stool coming out all at once. So that's one thing that you could do. And that's pretty much it. All right, so of course, if you guys have any questions, feel free to let me know. And I love you guys, and see you guys again next time I make another video. Love you and happy Sunday.